Today we shall be talking about fundamental concerns in interpreting GCMS analysis results. My name is Che, and do subscribe to my channel. Thank you. So to start with, we shall be talking about molecules in nature, then the discovery of antibiotics, then herbal medicine. Pharmaceutical chemistry shall equally be discussed, and then we talk about GCMS analysis, then the fundamental considerations in interpreting GCMS analysis results, and as it is customary of us, we shall be giving the summary. So, molecules in nature laid the foundation for the pharmaceutical industry, which dates back about 3,000 years ago. Everything needed for success and survival was provided by their surroundings, and many modern medications are derived directly from natural sources, such as Vitados, an anti-cancer drug used in Cuba, was derived from scorpion venom. Salicin, a precursor of aspirin, was originally derived from white willow bark. Cinchona bark is the source of malaria-fighting quinine. Periwinkle yields vincristine, vinplastin, an anti-cancer drug. And opium poppy yields morphine for the treatment of diarrhea. The list of modern drugs derived from natural sources is seemingly endless. So what about the microorganism-based drug discovery program? Do we have any drug sourced directly from microorganism? Let's check. You know, another addition is the microorganism-based drug, and one of the single most significant medical breakthroughs ever achieved in the history of medical science was when Alexander Fleming discovered penicillin from a common mold called Penicillium notatum in 1928-1929, arguably the most significant medical breakthrough ever achieved in the history of medical science. It altered the human path to disease cure. Another man called Selman Waxman, a Ukrainian immigrant to the United States, who discovered actinomycin in 1942 from a new group of microbes called Actinomycetes, though little is known about him. But what is the current state of the microorganism-based drug discovery program? The truth is that it is declining, but we shall talk about that. Quickly, we go to herbal medicine. Remember that herbal medicine is pharmacy. Getting the herbs from the bush is a branch of pharmacy known as pharmacognosy. Taking it to the laboratory and analyzing the toxicity is a branch of pharmacy known as pharmacology. Then pharmaceutical chemistry is where the whole components for structural elucidation is tested. And we talk about pharmaceutics is where these drugs are compounded into different formulations. And finally, to clinical aspect of pharmacy where drugs are dispensed. So, we shall dwell on pharmaceutical chemistry today. For example, you identify the part of plant based on the folklore reports to be useful in the treatment of typhoid, and you needed to give some scientific explanation for the folklore belief. So, you start by collecting the plant parts and devising a way to get an extract of them. You know, the plant parts will be gotten and then dried at room temperature. Thereafter, you pound. After pounding, you may proceed to blend, and after blending, then you get the plant parts in powdered form. The extracts are always gotten from the completely dried parts of the plant, you know, through extraction. So, and during extraction, you put into consideration the solvent, which could be polar, which could be non-polar, which could be semi-polar. But the underlying denominator is that the solvent will soak up the extract, and the extract is subsequently obtained through rotary evaporation or water bath. Now the extract will be appropriately diluted and tested against the etiologic agent of typhoid fever. In this case, we talk about Salmonella species. So if found to contain the antibiotic property, the unknown extract can be compared to a known compound in a database. So this is where we use the GCMS analysis in comparing known to the unknown. So gas chromatography mass spectrometry is an analytical method that combines the features of gas liquid chromatography and mass spectrometry to identify different substances within a test sample. The unknown spectrum collected by mass spectrometer detector is analyzed against all the library spectra, and then you take into consideration three key compounds. One is called the match factor, the second is called the reverse match factor, and then the percentage probability. You consider that when interpreting GCMS analysis results. So the match factor is a comparison of the unknown's mass spectrum peaks to those of the peaks in the library spectra, an indication of how similar the unknown spectrum is to the library's known spectrum. So a scale, we shall talk about that. So we go to the reverse match factor. A reverse match factor is the match factor when the peaks in the unknown spectrum that are not in the library's known reference spectrum are ignored. This number is useful when two compounds are correlating in the chromatogram. Then we talk about the percentage probability is determined by first assuming that the unknown spectrum is present in the library. So these three key features are what we consider when interpreting GCMS analysis result. Although the retention time is a measure of the time taken for a solute to pass through a chromatography column, and it indicates the compound's elution time, polarity, and volatility. So a base peak percentage abundance reveals the most abundant and stable ions in the mixture. So we talk about match factor. A scale of 0 to 999 is used by the National Institute of by NIST. A score of 99 is a perfect match with all peaks in both spectrum matching, while a score of 0 indicates that no peaks in the unknown are in common with the known compound spectrum. Now, for example, a score of greater than 900 is an excellent match. From 800 to 900 is a good match. 700 to 800 is a fair match, and less than 600 is a poor match. So these are some of the things you consider when you have your GCMS analysis results. Thank you.